I'm Bunmi Disu. I was born on the 14th of April in 1990 in a small town called Odogbolu in Ogun State in Nigeria. I had my primary education at Mayflower Junior School in Ikene in Ogun State. And then I had my secondary education at Federal Government College, Odogbolu in Ogun State. And then I came to Ibadan, University of Ibadan, to study medicine in the year 2007. And I'm just about to wrap up my program in June. I had a 2-week clinical elective. So I spent my first week in anesthesia and critical care. I was posted to the surgical ICU. So there I saw how they usually manage patients immediately after surgery, make sure they are stable, make sure everything is fine with them till they can be transferred back to the floor. So that was what I did in the ICU basically. And then I spent my second week in hematology oncology, where I saw how various types of cancer and complications of chemotherapy and things like that were managed. So that was how I spent my clinical elective. A typical day usually starts, I wake up, say my prayers, get ready, get on the bus or train, and then get to school around 6:37, when I was in the ICU at least. And then when I get there, I usually have a patient each day, so I review my patient, check what's going on with the patient, find out how the patient feels overnight and all of that, examine the patient, review vitals, and then we have pre-rounds with the resident doctors. After that, then we have the rounds. In the rounds, we present what we found out to the attendings, and then we all collectively make decisions on how to further manage the patient. And then after the rounds, we usually have teaching sessions with the attending. I had another student, so we were two. And then attending teaches us various topics. After that, we could have one round, seminars, and then the day ends and I go back home. A lot. I mean, there are a lot of major differences between the healthcare system here and the healthcare system in Nigeria. For instance, one thing I noticed was the fact that there's so many people managing one patient. On each patient, there are pharmacists, there are social workers, there are hospital assistants or doctor's assistants rather, practice nurses. I mean, so many people come together to manage patients, and it's really good because when the whole aspects of a patient's management is taken into consideration, it's better that way it's better for the patient that way. So one thing I noticed was the integration and how everyone works together. And then here too, the electronic medical record system is just like, I mean, it just makes things so easy. You don't have to go up and down to get different things. So you have all your data, and data is important. History, your patient's past history, your patient's present history. It's really important in managing the patient. For instance, if you have a patient who can't talk or you can't find any relative, because everything you need is right there in front of you, it kind of made things a lot easier. And then also I saw some procedures being done, like I saw a central line being inserted. I hadn't seen that before. I saw how a resident used an ultrasound probe to set a difficult IV line. I hadn't seen that before. So many other things. I was taught various topics by the attendings I rotated with, and it was just a wonderful learning experience, My interest for a while now has been in clinical pharmacology and drug research and all of that. So, well, this experience didn't really take me towards that line. But one thing I took from this experience is I actually did not know that anesthesiology could be quite interesting. And the 1 week I spent in the ICU actually opened my eyes to a lot of things. So I'm happy I came, and I'm happy I went to anesthesiology rotation because I really learned a lot and I actually kind of got a bit interested in it. So we'll see how it goes. I was sent a mail by my school to come for an interview for a sponsored elective program. So I went, 4 of us were interviewed, and then 2 of us were selected to go for the program. And so after I was selected, then I applied, sent in my forms, and the process began. It wasn't really easy because I had problems at the embassy, but thankfully I went back a second time and I got the visa. So here I am. This is a very beautiful, beautiful, and very, very cold, cold city. That is what I think. But I love it, and I hope I'll be able to come back another time when the weather is warm. But I did love the city. It's a wonderful, beautiful. Oh yes, of course I would. I mean, it's a whole new world out here. It's just a very wonderful experience. So yes, I would recommend it. Yeah, plenty. So let me start from my school. I'd like to thank the Dean, Faculty of Clinical Sciences, Professor Ajayoba, for this wonderful opportunity. I also like to thank Dr. Atalabi, our sub-dean. I'd like to thank every member of the Faculty of Clinical Sciences, University of Ibadan. I also like to thank Mrs. Bolanle Oyedele for all her relentless efforts in making sure this program happens. This wouldn't have happened without her. I'd like to thank Professor Jengbede Disu, the coordinator of the Center for Population and Reproductive Health at the University of Ibadan. Here, I'd like to thank Dr. Fumi Olopade, Dr. Shola Olopade too, for being a wonderful host and teaching us so much. I also like to thank Dan and Nkem for being wonderful hosts and for taking good care of us while we're out here, and also everyone in the Center for Global Health, University of Chicago. And then my family, my mom, my dad, my brother, my sisters, my roommates, my friends. I mean, it goes on and on. I'm very grateful to everyone. And above all, I'd like to thank God for making all of this possible.